all the applique dancers coming in here. Good job. Moose Hill, take it away. You're on the air. Y'all now listening to Moose Hill all the way from the state of Kansas. Good job.
Ladies and gentlemen, coming in the arena at this time is your Teen Girls Traditional. Teen Girls Traditional dancing style. Coming behind them is the Junior, the Teen Girls Jingle. Looking good dancers, you're looking good.
Hey, get the song ready. We still got our teen categories coming on in. Good job. Here, come on into our junior categories. Welcome, children. Our children, our youth. Our future is coming into the arena here at this time. Good job.
Coming into the arena at this time is your Teen Girls Fancy. Junior Girls Fancy. Come on in, ladies. Come on in. Dance your style. Dance your style.
Good job. Good job. Yeah. Good job. Hey, now she be down there. Good job. Good job. All our dancers are in the arena. I want to say thank you to each one.
Hey, stand by, everybody. Apologize here. We're having some other technical difficulties. So, Danelle, 1 second while we're going to reboot. Emily, can you count to 10 again? We're doing an audio check now. We did get picture. Okay, for some reason, we're not getting a good signal from that camera, so stand by, everybody. All right, try it again, Emily.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
We are golden, guys. I think we got it. Technical difficulties. Must be a Thursday. So once again, we thank everybody for joining us here today. We're trying some new things out down here at the gymnasium as we kind of roll back some of the stuff to get the tribal council. We just had a swearing-in ceremony, so we rearranged some of the chords, which has caused us to we got to plug in the right chords here. So with that, we'll turn it over to John from the Winnebago Pandemic Task Force. John, we didn't get your opening statement. I apologize for that, but if you could, we are live.
Thank you, Garen. Good afternoon, Winnebago membership, Winnebago community, Winnebago workforce. I wanted to start off by saying about what happened today. You know, I felt really good today. Like Garen said, we had our swearing-in ceremony, and we was able to fill 2 vacant seats, and we have a full council. A real good time, encouraging time for us. And it's been a while since I was able to see fellow council member Louis LaRose, and I seen him, and I felt real good, and I expressed that to him. You know, it's real good to see you, Louis, and how all of us are kind of like that, and how I'm really looking forward to seeing everybody after this, and how the powwow's coming, and that's going to be a real good time, a healing time for us. Oh, that's good medicine. We're good medicine for each other, and I just wanted to share some of that, how I felt good today, because I was surprised, you know, and it did a lot for me. And with that, I wanted to provide a little update on the task force. There was a question about the task force, and going back, we formed this task force because we understood that it was a big job that was before us. And the first thing that we accomplished was making plans and developing a budget, you know, which was a big accomplishment. But it wasn't over from there. It's not over from there. Now we've transitioned to implementing this plan and this budget, and ensuring that we utilize these funds for what we can do. And so it's no small task. You know, the job isn't over, and we're continuing. And how it's a real big, because some of these areas that we want to focus on, they're flooded, you know, with everything else that's going on in the country and in the world. So it's hard to get things, and it's hard to get things done. But I'm real encouraged because we have good people that are accomplishing these things, and everything is on track. So I wanted to say thank you to everybody who has had a hand in that, and just touch on some of the things that are going on. The utility assistance continues. There's still funds available. So if you have not put in your application, please do so we can so these funds can reach you, and what they're for, you know, the funds, and the task force. The small business grants, we approved 2 small business grants, which is really good. Get that money out to these businesses that need it, and even looking at another very special thing that's happening within the task force and the tribe and its entities is the quarantine housing that's developed. It's a model for what can be done, and other people are looking at that, and we're happy to share it because we understand that we're all facing the same obstacles, that have the same solutions, and we're going to draw on other tribes, and we hope for tribes to draw on us, that we're all in this together. So with that, I wanted to pass it along to the Winnebago Comprehensive Healthcare System CEO, Danelle Smith. Thank you.
Thank you very much, John. Good afternoon, everyone. Thank you all for joining this week's live stream update. As always, I hope that you and your families are healthy and doing well. I believe that this is week 18 of our COVID and community updates for Winnebago. A lot of work has gone into preparing for and responding to the coronavirus pandemic in Winnebago and throughout the area, all in an effort to protect the health and well-being of our community. We hope that these live stream updates have been beneficial to you, as well as the question and answer session and the opportunity to get this information in this format. Overall, I think we as the Winnebago community are doing fairly well considering the circumstances. But as you can see from what is happening in other parts of the country, we are not out of the woods. It is continually important for us to take precautions, each and every one of us as an individual, in order to protect ourselves, to protect our families, and protect our elders. We will continue these efforts and hopefully to be able to keep our numbers low and to further prevent the spread of the virus in Winnebago. At this time, I will go ahead and turn it over to Mona Zifante, our Public Health Administrator, to begin this week's healthcare presentation. Mona?
So actually, I guess I have just a few words, opening comments, and then I'll, Angie wanted to do the presentation this week, so I'll turn it over to her at that time. So thank you, Danelle and John, always, for everything that you guys say and do. Good afternoon, Winnebago community. I just have a few updates for the Public Health Department. Dental will be opening up next week for full services, so appointments will be starting to be back up, and they'll switch on the lighthouse, which is the appointment reminder. So you'll be starting to get appointments. Also, we still have slots left for the chiropractic clinic on the 31st, so you can give Nyla a call if you would like to schedule an appointment, if you're having some neck, back, or overall skeletal issues. The Public Health Department is still into phase 1 for their programs, and we will constantly review and, of course, keep people updated as we continue to go through that process, continuing to keep the precautions that we've set in place, trying to make and resume an effective and safe as possible. We will be reviewing and determining whether we'll be moving into the next phase, but we will keep the public updated on our Facebook page as we can. The Winnebago Public Health Department has been working with Educare and the Public Health School on some of their opening plans and activities, so we'll try to make them as safe as possible. We're also working with just the different entities that make various requests. We're trying to make ourselves available whenever called upon for the various areas. So I also want to thank everyone that was very patient and understanding of the CHR screening during the voting process. I also did have a message from Atlas. There has been some issues with some expired food, and they're working with the suppliers in order to prevent that. And there are sometimes 2 different dates on some of the food, so we want to make sure that we're looking at the expired date. But if you have any questions, please let Atlas know. Some other events that are coming up, we still have the virtual walk run that you can register from the winnebagotribe.com, and that can be completed anytime through July 1st through the 31st. And then you just submit to your log through the various apps. And of course, if the community elders want to participate and they don't have the ability to use an app, they can come down to Land of Wellness between 9 and 11:30 during July 20th through the 24th. And then they can assist you then. Also, A reminder that Pet Care event is on July 22nd from 10 to 5 at Land of Wellness. We're asking everyone to stay in your vehicles with your mask until you're called upon. We'll also be looking for some community members that would like to participate on the T-CHIP committee, which is our Tribal Community Health Improvement Plan. We are focusing on behavioral health and healthy living. This will be a 5-year-long process, and it is a living document, so it's ever changing and adapting to our needs. I want to thank everyone for everything that they're doing within the community, all the sacrifices for the past several months as we now move into our new stage of normal. And now I will turn it over to Angie Keller.
Good afternoon, and we'll go ahead and get started with the community updates for today, July 16th. The current statistics for the COVID cases here in Nebraska are 219,996 tests that have been completed. Of those, 198,026 have been negative. 21,717 positive results, and then a total of 286 deaths for the state of Nebraska. Winnebago, there has been a total of 450 tests that have been completed. 370 of those have been negative, leaving 74 positive, and then 69 of those have recovered. And then there has been a total of 3 deaths, and there is currently 6 tests that are still pending. And then for non-Winnebago residents, we've tested 389. Total tests have been completed. Of those, 309 have been negative, 62 have been positive, and there's 18 tests that are currently pending. And then this is just a slide to go over what your risk would be for being exposed to COVID with different activities inside and outside. So as you can see, there's low risk, moderate to low risk, and then moderate risk. Low risk would include going outside to get your mail, getting takeout at a restaurant, getting gas, home exercise, grocery pickup at the curb, or having them deliver them to your car. And then the moderate to low risk would be going to the actual grocery store to go shopping, going on a walk, bike, or other activities outside, playing golf. There's going to the museum or to the library. Sitting in the doctor's office would be very low risk, would be a moderate to low risk. If you choose to go eat at a restaurant, then eating outside would be the best option for that, if that's available. Spending an hour at a playground with social distancing, and then attending a powwow outside would also be low to moderate to low risk. And then exercising at Whirling Thunder is a moderate to low risk. They have a bunch of new processes in place to help prevent any exposures with the equipment or to anybody within the facility. Moderate risk would be having dinner at someone's house that's other than a household member, attending a barbecue, going to the beach, going shopping in a mall or a busy store, sending kids to school or camp or daycare, working a week in an office building, going to a public swimming pool, visiting an elderly relative or friend that is outside of your household, but actually in their home, traveling on airplanes, sleepovers or slumber parties, and then singing and dancing in a powwow. There's just more chance of droplets being exposed when someone's singing. And then the moderate to high risk and the high risks are on the next page here. The moderate to high risk is going to the hair salon or barbershop, eating inside at a restaurant, getting restaurant takeout could be one if you actually have to go inside the restaurant and get it, and if you don't properly clean the containers that they come in. Attending a wedding or a funeral or any other large gathering, playing contact sports such as basketball and football, hugging and shaking hands, public transportation on buses or other forms of it, and then church services with 500 people or more. And then the high risk exposures or activities that someone can participate in would be going to amusement parks where there's very large gatherings, sports stadiums, family reunions, large music concerts, bars, buffets, casinos, and movie theaters. And that's just with it's harder to maintain social distancing, and normally there's more individuals in close quarters in those activities. So it's a good idea to keep those in mind whenever you're planning any of your activities and take the appropriate measures to help prevent any future, any exposures. And then here's just a couple little updates for what people within the community can do if they're visiting family and friends that live outside their household. So always make sure you're wearing a face covering or a cloth covering over your mouth and nose, and that's just going to prevent any exposures for that individual, and make sure the other the family or friends are wearing the same face covering or wearing their own face covering. You want to maintain a 6 feet distance, so it's about 2 arms lengths apart from you and the other individuals. If it is possible to meet outside or talk outside, but maintain that 6 feet distance. Wash hands often or use hand sanitizer. And then to wipe down all the surfaces and disinfect anything that's being touched. So tables, parts, benches, playground equipment, things like that, to help prevent any of that transfer of the virus. And then with the weather getting warmer, more people are going to the pools or beaches. So it's a good idea to take precautions when going there. It's important to wear a mask or face covering when you're not in the water. You always maintain that 6 feet distance, so that 2 arms length apart. Wash your hands often, and then wipe down all surfaces again. So the chairs that you sit on, or make sure you're bringing in your own towels, sunscreen, things like that. And then the Winnebago Public Health Department accreditation updates. Mona did touch on a couple of these briefly, but I'll kind of go over those again. The Tribal Community Health Improvement Plan, or the TCHIP, is looking for dedicated community members to have an interest in living healthy or behavioral health. The meetings for the TCHIP committee will be quarterly, but there are tasks that are to be completed on a monthly basis, so there will be some active involvement. And if anybody is interested, please contact Mona Zavante or Lene Bigfire, and they can give you the information and add you to the team. And then the Nebraska Partnership of Mental Health Care, they are looking for parents that want to influence the use of telebehavioral health services in the state. The influence the following: so parental satisfaction with the children's mental health screenings, care, and counseling services. Extent to which the parents feel they are empowered as decision makers in the family's care, so in the child's care. Extent to which parents agree that they have access to needed family supports. And then following implementation of the survey, they'll analyze the results to identify family voices, the needs, and the co-occurring conditions, and identify the resources that would be useful for those. If you would like to participate in this, the contact information for Jennifer is at the bottom there. You can email her at jenniferalman@nebraska.gov. And then next will be Danelle, and she'll kind of go over the changes here at 12 Clans Unity Hospital.
Thank you, Angie. At 12 Clans Unity Hospital, we are starting to do increased COVID-19 testing. Starting next week, COVID-19 testing at 12 Clans Unity Hospital will be widely available for anyone who wishes to get tested. Testing does show if you currently have COVID-19. And so if you have been exposed to the coronavirus, we must always keep in mind that the incubation period for the virus is around 5 to 7 days, but it can be up to as much as 14 days. And so that is accounts for why the quarantine period after somebody's been exposed is up to 14 days. So testing too early after an exposure can result in a false negative test. So we do want to make sure that testing is available. In the past, there was some criteria that we had to follow, such as being symptomatic or having a known exposure and waiting a certain period of time. But the testing supplies have opened up, and we do have tests available. And so we are now able to open that up for our patient population. And so if you want to get tested, you just need to call the outpatient clinic at 402-878-3404 to schedule an appointment. The testing will be done by appointment only. And again, you do not have to have symptoms in order to get a COVID-19 test. And it's open to both symptomatic and asymptomatic patients. Whenever possible, the lab collection for the COVID-19 test will be done outdoors through our outdoor drive-up testing area, which is over by the EMS garage on the east side of the hospital. The hours for testing will be Monday through Friday from 9 a.m. to 12 p.m. And we are able to accommodate about 20 people per day in 10 to 15-minute increments. And so we will monitor that, and the demand for questions, or excuse me, the demand for testing. Hopefully we can accommodate the demand during those time periods. If not, then we will reassess the schedule for testing so that we can make sure to get people in a timely manner. Patients will be notified of their test results by phone as soon as possible. Current turnaround time for the tests that we send out to the lab is up to 2 to 4 days. Sometimes it can be more. It just depends on the volume of tests that the lab has at that time and what their capacity is. We also do have the Abbott ID Now rapid test, and that is up to the provider to determine which test is most appropriate for your circumstance. Keep in mind, again, just education about what to expect from testing, that it is possible to test negative for COVID-19 after an exposure and then later test positive because of that incubation period. And so if you test today, there's a possibility that you could be exposed tomorrow and then still be positive within a few days, or if you test too soon after an exposure. So if you're interacting with somebody, today who is positive for COVID-19 and you go get tested tomorrow, it may not show up at that point. And that's why we have that time period for quarantine after a potential exposure. And while you're waiting for your test results, it's important to maintain the quarantine and the isolation so that you don't potentially spread it before you've had a positive test result. So again, it's important, even if you do test negative, if you think that you've been exposed to COVID-19, that you should still take those steps to protect yourself and just in general, because you just never know. The next information that I would like to share is the efforts that we are taking now to resume outpatient clinic services. We've already started to schedule appointments for physicals and immunizations, and the clinic schedule will be open for appointments, for regular appointments starting next week not next week, a week and a half from now on July 27th. But you can now call the clinic at 402-878-3401 to schedule an appointment for any preventative care that you may need or that may be that you've put off during this COVID-19 period. Keep in mind that we will have a high demand for those clinic appointments, so there may be a bit of a delay in the availability of appointments as we try to accommodate all of our patients and get everybody back in and schedule those appointments that we need to. So we really appreciate your patience and understanding while we work to meet everyone's needs. Your safety is priority. Checkups and regularly scheduled appointments are safe to access, and so we want to reassure our patient population that we're taking all the extra efforts at the hospital and throughout the clinic and other areas to ensure your safety. Additional cleaning measures have been implemented. Social distancing measures are implemented throughout the facility. Appropriate PPE is worn by staff, and of course masks are required by patients anytime that you're in the hospital. And we also continue to have the screening process at the door so that we can just really take all those efforts to help keep people safe. Finally, really pleased to announce that we are launching the website for the Winnebago Comprehensive Healthcare System, the health department, and the hospital. And so those websites are live as of today. You can go to www.winnebagohealth.com to access the website for the Winnebago Comprehensive Healthcare System, and there are links there for each of the divisions of our organization, both the 12 Clans Unity Hospital and the Winnebago Public Health Department. Do have our live website now available for information. So we look forward to having that as another tool to provide information to the community and a good resource for you to go to get information about all of the services that are available and other updates. And we will continue to update those websites going forward into the future. Thank you. That concludes our presentation for WCHS.
Thank you, Danelle, Angie, and Mona. At this time, we'll turn our attention to the Winnebago Chief Executive Officer, Esther Mercer, for the weekly update. Esther.
Thank you, Garen. The tribe is continuing to move forward with a targeted deadline of August 3rd for resuming limited operations. Beginning next week, the tribe will begin the process of recalling staff who are currently on furlough. The goal is to have 100% in-office coverage of our departments by August 3rd. We will also be making revisions to our workstations over the next few weeks, such as installing plexiglass barriers around desks and installing air purifiers in our buildings. Again, we ask that the community guidelines be adhered to with respect to accessing our departments during this pandemic. While the rates of infection have gone down in the community, we all need to continue to do our part to keep it that way. There are still funds available for the Utility Assistance Program. They are only available for those of you who have not yet received assistance. Please reach out to the Human Service Department if you have not yet received assistance through the utility program. Please continue to adhere to social distancing guidelines as set forth by the CDC and the Public Health Department. Please continue to wear face coverings as it is critical to preventing the spread of this illness. Thank you and have a good day.
Thank you, Esther. And we're going to continue on. Winnebago Public School is in the meeting at this time, so we're going to go to Little Priest Tribal College. President, if you would.
Good afternoon. I hope everybody's doing well. Here's a quick update from Little Priest Tribal College. Our graduation is on July 31st, 2020 from 11 a.m. to 1 p.m. Again, on behalf of the college, I would like to invite all the members of the community to attend the first and hopefully the last commencement, virtual commencement ceremony. Our guest speaker for the graduation commencement is Danelle Smith, CEO of the 12 Clans Unity Hospital. We are excited to celebrate this occasion with our graduates. Fall 2020 semester starts on August 24th. We have exciting opportunities for the members of the community. And so I request all the members, the listening audience, to take advantage of the incentives we are providing to continue your higher education or to be a lifelong learner. Please contact Financial Aid Office 402-878-2380, option 1. The college reopened on July 6th for employees only with strict screening. As we anticipated, we have some growing pains, but we are learning quick and adapting as needed. We are making sure the health and the safety of the employees are of the paramount importance. We're taking cleaning, sanitization pretty strictly. The college remains closed on Fridays as we do extensive deep cleaning. Again, on behalf of the college, we're excited to welcome all the students to the fall 2020 semester. We also want to take this opportunity again to welcome all the members of the community to come to our graduation. Again, have a great day and take care of yourself.
Thank you, President. And just to clarify, that virtual graduation is going to be held virtually, correct?
Yes, through Zoom. We have updated our Zoom links on Facebook and college website. If anybody else wants more information, please contact Director of Student Support Services, Tricia Wagner.
Thank you. We do have a note here from Winnebago. They also got pulled into a meeting, so we're going to continue on. Sam Burrish is not going to be joining us here today, but Allie Carson from HCI will be doing the updates. Allie?
Yeah, thank you. Thank you, Garen. So good afternoon. I'm Allie Carson with Ho Chunk Inc. I have a few brief updates today. As a reminder, the Pony Express stores have recently expanded hours. Those hours do vary by location. That information can be found on the Pony Express stores Facebook page. Ho Chunk Inc. has been in the news recently. The company is part of Keep the Money in Nebraska. It's a political committee and partnership between Ho Chunk Inc. and the Nebraska Horsemen's Benevolent and Protective Association. The group supports a series of 2020 ballot initiatives or ballot measures to expand, tax, and regulate casino gaming at licensed horse tracks in Nebraska. We helped collect more than 475,000 signatures. That far exceeds the number needed to make the November 2020 general election ballot. You can learn more about Keep the Money in Nebraska on Facebook and on their website. In the Winnebago community, Ho Chunk Farms has started work on a new long-term project. It's a regenerative agricultural system that will eventually include 1,500 egg-laying hens. Recently, Ho Chunk Farms and community partners planted 1,400 hazelnut trees. Next, a chicken coop needs to be built and fencing installed. This is happening on a 3-acre plot at the tribal farm. The project is part of larger tribal food sovereignty initiatives. If you'd like to learn more, we have a full story about that and photos posted on the Ho Chunk Inc. Facebook page. Those are all the updates I have for you today. Thank you, and I will turn it over to Brian Mathers with HCCDC.
Thanks, Allie. On behalf of Ho Chunk Community Development Corporation, we'd like to extend our congratulations to Lorelei Decora and Brian Chamberlain for their appointment to the Tribal Council. We look forward to working closely with you as we do with the other Tribal Council members. And I'd just like to offer myself, if you'd like to call and learn more about the various ways that we partner and collaborate with the tribe, I'd be happy to have a meeting or a discussion about that with you. Couple of things that are coming up in the next few days is tomorrow morning is a Friday. So it's going to be one of our farm to food distribution days, starting at 8 o'clock in the morning down at the farmers market facility in the Ho Chunk Village. We'll have the produce boxes tomorrow that have all the fresh fruits and vegetables. And we'll also have supplemental products that have been purchased through a foundation donation and sourced through Flatwater. So they're from other tribal organizations and producers. It's really good stuff. So it's a nice package of food. Just need to come down and get in line with your car and drive through, and we're all masked up and gloved up, and we'll just deliver it right into your car. So 8 o'clock that starts. We go until they're gone. We have 240 of those to give out tomorrow. So come down early, and we'll get you set up for that. We've also had another week of our farmers market operation that's going on in Winnebago. Those are every Wednesday. Just had it yesterday, and we'll have it again for the next few Wednesdays through the end of September. So it's 1 o'clock to 6 o'clock. That's also at the farmers market facility in the Ho Chunk Village. So stop down, and we're having more vendors there every week as we get into the growing season, and more types of produce are available. I bought some gooseberry jelly there yesterday, so there's some interesting products down there. So come down and check that out. we have been running a project for the last 5 years in partnership with the Winnebago Public Schools and the Wall Hill Schools called the Native Students College Vision Quest. That project is coming to an end in September. And because of the pandemic, we weren't able to do some of the grant activities over the last few months. So we have some extra money in that grant. And so we're working with the schools to purchase additional Chromebooks and tablets and things like that to help with, to have some redundancy in the distance learning protocols, just so they'll be prepared if we have to move more in that direction temporarily once it becomes clearer what the protocols are going to be around reopening the schools in the fall. So we'll be looking at doing that and making the best use that we can out of those grant dollars in the time that we have to spend them before the end of September, hopefully in a way that sets up, that builds capacity long-term for distance learning in the communities. So that's what we've been focused on there. That's really the main things that I had to cover today. Again, I have to reiterate what a wonderful community this is to do this kind of work in. Not only during the time of a health pandemic and crisis and difficulties, but really all the time, the partnering, the collaboration, the shared concern. It's really inspiring to me every day. And I think that, it's a testament to how much people care about this community, the fact that we're getting through this and we'll come out stronger on the other end of it. So 18 weeks we've been at this, and it seems like a long time, but the community is getting stronger, and we'll get through it no matter how long it takes. Thanks.
Thank you, Brian, for that update, and appreciate those words and those encouragement. And just sitting here thinking 18 months or 18 weeks that we've been doing this is very long, but hopefully the end is in sight. Due to you folks doing everything you can for the community and for the tribe. At this time, we'll turn it over to Emily Longeski, from the Communications Director from the Winnebago Comprehensive Healthcare Systems. Emily.
Thanks, Garen. We'll move on to the Q&A portion of today's live stream. Reminder for everyone watching, you can submit your questions to covid@winnebagotribe.com by email, or just type your questions in the chat box on YouTube or Facebook. So we'll go ahead and get started with the first question. Where does volleyball rank on the list of risk? Or Angie, can you take that one?
So volleyball would probably be on there's not a lot of impact with it, but you do share the same ball. So it'd probably be on a moderate risk. If someone is participating in volleyball, what I've seen some people do is you have to maintain that 6 feet distance, which should be able to do. And then make sure you're wiping down the ball with wipes or anything like that whenever someone comes in or off the court. That'll help prevent contamination or exposures from that. But it'd probably be on a moderate, listed as the moderate risk, just because there can be some close contact at times with that sport.
All right, thank you for that information. Next question, what is the health department's thoughts on kids going back to school? Mona, do you want to answer that, or Angie?
So I think after the 2 o'clock forum that Dan is on, the community will be sharing their thoughts and their ideas. And I know I spoke to Dan earlier this morning in regards to going back to school, and that will support them, of course, and try to figure out a way to make that, whatever decision is made, as safe as we possibly can. Of course, we need to look at, all aspects of whether it will be safe for the children to come back with all of these measures put in place with masks and sanitizing and limiting the amount of children in any given area. So trying to work through all those variables. I know school would be starting right up around the corner. So just looking at that, whether learning is being effective at home. I know we've been talking about the Wi-Fi and the internet And it's not conducive for some of our kids to just sit in the parking lot either to try to access some of the Wi-Fi services. So I know that the pandemic subcommittee IT is working on that as well. So just trying to find a common, so there's not yes or no, I guess. And I don't know if that's what people want to hear, but I don't have a yes or no. So I think that we don't know what the fall will bring. So I think that we need to just try to do the best we can. And so I know that's what the school would like to do. So it'll be interesting to hear what the community's thoughts and feelings are and how we can be supportive in that.
Got it. Thank you, Mona, for that answer. The next question is actually our last question. We had a question and somebody wanted to know if there was any plans on doing any more mass testing. Danelle or Mona, if you want to answer that one.
At this time, we don't have any plans to do any mass testing events like we did several weeks ago. But as I mentioned in the presentation earlier, the hospital has opened up testing. And so anybody who wants to be tested, whether you're symptomatic or asymptomatic, or whether you think you've been exposed or not, is able to call in to get an appointment to go to the hospital to get tested during our testing hours, which is Monday through Friday in the morning.
Awesome. Thank you so much. So that wraps up today's live stream Q&A session. Thank you to Angie, Danelle, and Mona. I'm going to throw it over to you, Garen. Do you have any other?
Yep. There's some questions that are coming in regarding the powwow. And so just to kind of let the viewers know, some of those questions are directed to the powwow committee. And we're going to give them an opportunity and extend an invitation to them to come out next Thursday, right before powwow, to answer some of those questions. And they're kind of health related, but I know that Mona and the health department have been working, and I believe they do have a plan as far as like taking temperature checks and stuff. That information will be rolled out forthcoming here as well. But as you know, mark your calendars for Saturday next weekend. And that's going to be a one-day celebration for the 154th annual homecoming celebration. But yeah, some of those questions are directed towards the powwow committee, and we'll give them an opportunity for them to answer those questions. So with that, I appreciate everybody, Danelle, Brian, Esther, Ali, Angie, Mona, and Emily, and John Snowball for joining us here today. A lot of things going on, and if you folks have any questions or anything that you want to bring up, make sure that you email. Go to the Winnebago Tribe's website. They also have the listing of the tribal council members, including the new 2 tribal council members that just joined us here today that we had the swearing in ceremony. So folks, you be safe out there, and we'll see you next Thursday. Thanks.
Thank you.
Thank you.
Thank you. Bye.